All right, so when we're thinking about what treatments we are going to use for meningitis, so this is really dependent upon the common pathogens that patients are at risk for based upon their age. So this is really what is going to help you remember what antimicrobial therapy we're starting. It depends on what the patient's age is. So in general, what we're looking at is a third generation cephalosporin, so whether that's cefotaxime or ceftriaxone. Now, in our patients less than 1 month of age, we do not use ceftriaxone. And then, so we're also going to add vancomycin, and whether or not a patient needs ampicillin is going to be dependent upon their age. So we're adding that ampicillin for patients that are at risk of listeria. So that is going to be patients less than 1 month of age and those greater than 50. All right, so that brings us to our second learning assessment question. So which of the following is not a common cause of community-acquired bacterial meningitis? So Streptococcus pneumoniae, Haemophilus influenzae, Neisseria meningitidis, or Staphylococcus aureus. So the answer would be D, Staphylococcus aureus. This is not one of the common causes of community-acquired bacterial meningitis, but we will see it as a potential cause in patients with healthcare-associated ventriculitis and meningitis. All right, for our third learning assessment question. So this is a select all that apply. So which of the following antibiotics should be started as part of the Empiric regimen in a patient who is 60 years old, admitted to your hospital with suspected meningitis? And for the purposes of this question, we'll assume that she does not have any past medical history. So the options are vancomycin, ampicillin, cefepime, and ceftriaxone. And so we would want to add A, vancomycin, B, ampicillin, and D, ceftriaxone. So because this patient is greater than 50, we would have to add on the ampicillin to the standard regimen of vancomycin and ceftriaxone. All right, so now we have a fun fact for you guys. So if Staph aureus, and particularly MRSA, is not a common cause of community-acquired bacterial meningitis, why are we adding vancomycin as part of the Empiric regimen? So really, this is related to Streptococcus pneumoniae and the rates of resistance with this pathogen. So this has been increasing over time, and the exact prevalence depends on your area. And I would say in my clinical experience, I've seen rates of resistance around 20%. And what you'll see when you look at susceptibility results for some pathogens, as it relates to penicillin and ceftriaxone, is a susceptibility for if you're treating meningitis or non-meningitis. And you need a much lower MIC if you're treating a meningitis, because you're not going to get as high of concentrations of that antibiotic into the CSF. All right, so now I have another clinical question for you guys. So what about immunocompromised patients? So this isn't very readily discussed in the guidelines. And so how are immunocompromising conditions going to impact the overall risk of meningitis, as well as what pathogens we're concerned for? So overall, across different types of immunocompromising conditions, is going to increase the overall incidence. But if you're thinking about a patient with diabetes versus a patient with a bone marrow transplant, the higher immunocompromised patients are going to have a higher risk. What you can see, especially in some of our more immunocompromised patients, is less signs and symptoms. So because they have less of an immune response, they're not going to have some of those symptoms that are related to your immune response and inflammation. So that's important to know, and it can make diagnosis a lot more difficult. So we know that patients with certain immunocompromising conditions are going to be more at risk for listeria. And then depending on some specific factors, patients could also be at risk of fungal meningitis. This is really going to be our highly immunocompromised patients, like our AIDS patients, as well as some of our bone marrow transplant patients.